The purpose of this video is to introduce the sacroiliac joint, aka SI joint, and its relation to the pelvis and the spine in general. The reason this is so important is because the SI joint is the center point in our body, connecting our lower body to our upper body, and also because it is related to so many different issues like back pain and knee pain and other pains that we have that really originate from here but manifest elsewhere. And in order to understand what we can do to solve those and self-care for those, we have to understand what the SI joint is doing and our pelvis is doing. So when I look at the pelvis, I'm looking at three main structures. We have the one side of the pelvis, the other side, and then we have the sacrum or the tailbone. And down here we have the coccyx, which is an extension, a small extension of the tailbone. But for the purpose of this video, we're going to concentrate on the three structure: the ilium, another ilium, and the sacrum. Now, if you look here, there are three joints that we see in the pelvis. We have this joint, and it goes all the way down here. We have this joint, again, going down here, and we have a joint in the front. These are a little bit different than joints we have in the elbow or the knee or the shoulder, in that they are flat. If we're looking at it from the back, there's a really bone coming to bone together with very little intention for motion, but there's definitely motion that has to happen here. So this is the SI joint, or the sacroiliac joint. It's because it's the sacrum coming together with the ilium, sacroiliac joint right here. Now, why is that important? I mentioned before is that this is where our upper body connects to our lower body. And how is that happening? Well, the pelvis right now is just flat, but really when we're standing, the position of the pelvis is like this. So there's a very much forward tilt. And right from the sacrum, we have our lumbar spine sprouting up. So here I'm going to represent the lumbar spine with this twisty tie that I have. I'm going to put it that way. So as I'm standing, my lumbar spine comes up from my sacrum. And onto my lumbar spine, I have thoracic spine. I have many vertebrae that come up from here, and the rib cage that connects, and the shoulder that connects to the rib cage, and the head that's sitting on top of the spine. My whole upper body really comes to a point here. My lower body, through the knees, ankles, thighs, connect right here. This is the hip joint, and both hips connect here. And so where the body comes together is right over here. Now, one more note about the spine and the pelvis, and then we'll conclude this video. This position, as you can see, is nice curve. That's what we want to see. Nice little curve in our spine. This here is the sacrum. So if we're looking at the pelvis, in order for the sacrum to be in this direction, here is the sacrum here, my pelvis has to be in this position. If I'm in this position, my lower back is happy. See? Like that. This is hyperlordosis. This is where you have a curve, too much of a curve in your spine. That's as if I'm pulling the pelvis even forward, applying a lot of pressure on the back and causing low back pain or buttocks pain instead of being in a nice posture. So understanding pelvic anatomy and the SI joint in relations to the pelvis is going to be important in understanding the next couple of videos that I will share with you. Of course, at any time, if you have any questions about this, take a few notes and let's talk about it.